Hi, everybody. This is Reid. I'm going to give just a couple of 2 or 3 minutes of talk, and then what we'll do is turn it open to questions. So first of all, thank you very much for joining me today. We're going to talk about health insurance reform. I'm happy that we're going to be joined by so many Nevadans. The rhetoric surrounding the health debate has become increasingly heated. Healthcare is a very personal thing for everyone. Rarely do we work on legislation. In fact, never that I can remember, or anyone around here can remember, that we've worked on legislation that so directly touches everybody. Some of you on the phone may think we shouldn't do it now, do it later, never do it. But I think tackling America's healthcare crisis is critical to our nation's future and Nevada's future. This is a very challenging time in the state of Nevada. We face an economic crisis that has lowered our home values and left many unemployed, and a number of people have lost their health insurance. In fact, today, in America, 14,000 people woke up with health insurance and they'll go to bed tonight without it. In Nevada, 220 people this morning had health insurance. Tonight they won't. It happens 7 days a week all over the country. 220 in Nevada, 14,000 around the country. And the costs of health care are unsustainable for families in Nevada. Today, in our country, 1/6 of every dollar spent in America is for health care. If we fail to act meaningfully by 2020, it could be as much as 35 cents. Health care reform is critical for Nevada's health providers, who lose over $335 million in bad debt every year. I had people visit me yesterday from the Pahrump Hospital. It's brand new, little 25-bed hospital. And their bad debt, I think they told me it's 12.5%, meaning that brand new hospital, 12.5% of the people come in for care that they can't pay. So it's critical for Nevadans who have insurance, because you have premiums rise more than 60% since 2000. It's critical we do something about this. It's critical for Nevada small employers who struggle to provide insurance for their employees and need financial assistance and better choices to do so. For Nevada's kids, it's really important, 27 of whom didn't visit a dentist in the past year, and 38% who didn't receive a flu shot. So that's why we're working to enact health insurance reform, lower high costs for consumers. We'll ensure Americans have quality, affordable health care, protects coverage for people who like their coverage, allows people to choose their own doctors, hospitals, and health plans. Before we get into questions, I want you to know that I appreciate very much your interest here. If anyone wants to ask a question, press 0 on the phone. First, there are just a few myths I'd like to address. These are myths. Death panels encouraging euthanasia. There have been rumors that death care reform bills include a clause that everyone that's Medicare age will be visited and told to decide how they want to die. This is simply false. There was an amendment offered by a Republican senator from Georgia who put a provision in the bill that allows Medicare to pay physicians for counseling when their patients ask for assistance about life planning, end-of-life planning, such as hospice care, living wills. So that's only one of the 5 bills that even mentions anything. Next myth. Illegal immigrants will receive free health insurance. Language in both the House and the Senate draft bills explicitly prohibit federal payments for undocumented aliens. The Senate bill defines those who are eligible for premium credits as citizens or citizens or nationals of the United States. The House bill states emphatically, nothing in this subtitle shall allow federal payments for affordability unless people are citizens of the United States. Abortion, one of the myths. Health insurance reform allows taxpayer funds for abortions. This is a red herring issue, just something to divert attention. Under all the provisions, the Hyde language is carried forward. Henry Hyde was a congressman from Illinois, and he was famous for introducing a Hyde Amendment, which said that abortion coverage could be part of any provision, abortion coverage. And President Obama said that we should continue our current policy of banning the use of federal funds to cover abortion, except in the case of rape, incest, or when the life of the mother is at risk. And that's what the bill currently being considered by the Senate Finance Committee would do. Another myth. The other myth. Private health insurance will be illegal. That's not true, as neither the Senate or the House draft bills make private insurance illegal. Another myth. Government will have direct access to your bank accounts. Health insurance reform bills don't give the government access to your bank account. A couple more things. Rationing. There's misinformation out there that the bills will introduce a system of rationing health care, when in fact the health insurance industry already does it. So we're not going to legislate anything about that. They also say the cost of the bill will add $1 trillion to the deficit. These bills will all be fully paid for. They're deficit neutral. That's the rule. We can't do anything other than that. Finally, health reform doesn't. One of the myths is that health reform cuts Medicare benefits for seniors. Simply not true. Finally, with small business, it'll hurt small business. Health reform will help, not hurt. Health reform will provide tax credits to small businesses who cover their employees. This legislation will stop insurance companies from discriminating against small businesses with female workers, workers in poor health, or against workers with pre-existing conditions. The bill would limit discrimination based on age and provide small employers with a one-stop shop for their coverage. So those are some of the myths we had to dispel. So now press 0 and we'll be happy to respond to questions. We'll be available for about 45 minutes.
Senator Reid, our first question is from Victor Daniello in Las Vegas, who has a question about health care reform.
Victor?
Hi, Senator Reid. How are you?
Good.
Good. We only get one question, so real quick, I just want to understand how it is that in the face of record disapproval, not record, but extremely high disapproval ratings, and a country that's probably at best 50-50 on health care reform, as you put it, with, a public option, how is it that you can consider it even an option, let alone being a proponent of using reconciliation to pass a bill of this magnitude through the United States Senate?
Okay, let me explain to everyone. There are two questions that I think you have. One is, what do I think of the public option? And number two, how could we use reconciliation? I think those are the two questions. Let me respond to them. First of all, let's talk about a public option. What does this mean? Remember, the word is option, not public mandate. It's option. And the reason we're concerned about a public option is because right now the insurance companies have an absolute monopoly. They are the only business in America that is not subject to antitrust laws except Major League Baseball. Any other business could sit down in a room and conspire to fix prices. They would be subject to civil and criminal penalties, not the good old insurance industry. So we believe, those of us who believe in a public option, believe that in an effort to keep the insurance companies honest, to create competition, that we should have a public option. So there will be a vote on that, and we'll see where the votes are. Number two, the gentleman, Victor, said, how could you consider reconciliation? Well, we're not at a point where we have to do reconciliation, but for the listeners, without getting into a lot of detail, let me explain what he's talking about. We have for many decades now had a provision every year when we do our budgets to have a couple of things under that avoids the arcane Senate rules, that you can avoid filibusters. It's done for health care. It has been done over the years for education. It has been done in the past for other things. This year, in our budget resolution, we said reconciliation can be used for education, and it can be used for health care. Now, we want, I think I can speak for all Democrats, and I think a number of Republicans would rather do it on a bipartisan basis, have involvement of both sides. And we're trying to do that. There's been an open slot at all the tables negotiating for Republicans, and as some of you followed what has gone on in this, we've had 6 people, 3 Democrats and 3 Republicans, working, representing the Finance Committee now for months. They have been unable to, 2 of the Republicans have said, well, we're not going to help. One of them is Olympia Snow from Maine, said she's still interested in working to come up with a bipartisan bill. It would be nice if we could get some Republicans. We, for the first time since we've been Congress this time, we have 60 Democratic votes because we have a new senator replacing Kennedy who will be sworn in tomorrow at 3:15 Eastern Time. That's Paul Kirk from Massachusetts. So I hope we don't have to go to reconciliation, but if we do, we will do that. If we have to, we will do that. I would rather not do it for the reasons I've already explained, and the additional reason is that if we can do a bill like I've just talked about here and not do reconciliation, we can do a lot more than if we just do simple reconciliation, because under the budget rules, using reconciliation, you're limited what you can do. For example, it would be more difficult to do insurance reform. Okay, next question after Victor.
Our next question comes from Jeff Durbin in Las Vegas.
I'm sorry, what's the name?
Jeff Durbin.
Okay, good.
He has a question about tort reform. Jeff, are you there?
Yes, I am.
Please go ahead.
Reid, how come tort reform is not addressed as a priority prior to even introducing H.R. 3200? And the reason why I asked that question is because there's my son-in-law is a doctor. He pays well more than $250,000 in malpractice insurance. And
what kind of a physician? He must be a specialist with premiums.
He's a doctor of radiology.
Yeah, that's the deal.
But the thing is, though, if we really want to attack healthcare, reform at its basis, why don't we go to the basics? In other words, tackle tort reform, then go after the Medicare fraud, and then introduce the entire nation to the option of the FEHP program. Now, the federal employee,
Just let me answer. You've got several things here, and let me respond.
Okay, no problem.
Okay?
We'll go to tort reform.
First of all, I'll go through all of them: tort reform, fraud, and the federal plan. So let's talk about tort reform first. Let's get real personal here. As some of you know, I'm a trial lawyer. I used to be, at least. Could still try a case if I had to. I've tried over 100 cases to juries. I believe in the jury system. But even though I'm a trial lawyer, like everybody else, you get medical problems, and I've run a lot of marathons, and I started having a problem. I noticed it first on the Senate floor a few years ago when I felt like my sock had gobbed up on the bottom. I thought, what in the world is wrong? And I went off the floor into the privacy of my office, took my shoe off, pulled my sock off, and it still felt the same way. Without belaboring the point, I went to a number of doctors. They told me I had what is called a Morton's neuroma. And the only thing that would help it is surgery. So I go to the hospital for surgery. I'm on my back in the operating room with a little white gown on covering the essentials. And I look down at my feet. They're bare, I've nothing on. And on my right foot, there's a great big magic marker, a big X on that. And I thought, what the hell? So I said to the people in there, why do you have that big mark on my foot? They said, we want to make sure we do the right foot. That's where we're going to operate. Wrong foot. It was the other foot that the surgery should have taken place. Now, this isn't 50 years ago. This is a couple of years ago. Now, I was bold enough to ask, had it been my wife and I have been together a long time. She was born shy. She will die shy. And I doubt seriously if she would have said a word about her foot. She would have asked the question. She just doesn't, she's not a talker. And they would operate on the wrong foot. And now if there were ever a clear case of negligence, that's it. Now should those people who made that mistake be any different than somebody who is drunk and runs into you at a stoplight? I mean, it hurt you? The answer is no. However, I know that there's a lot of defensive medicine practice. We have to figure out a way to change that. I have a couple of ideas. One, we found that if doctors will acknowledge they've done something wrong if they're not going to get sued for it. And so one of the provisions I think should be put in whatever we do is something say, I'm sorry. And if you say I'm sorry, it can't be used in any way in any court proceeding. And I've learned from my past experience that would avoid a lot of lawsuits, because a lot of lawsuits are brought because doctors don't say they're sorry. Number two, I think before you file a lawsuit, there should be some certification by a doctor who works in that field. Your I think you said son-in-law's in radiology. It couldn't be an OB/GYN man. It'd have to be some of these radiologists who would certify that there's some basis for this lawsuit. We had in Nevada for a number of years a medical legal screening panel that worked okay. Now they got rid of it. The other thing I'm terribly interested in is this. Your son-in-law makes a lot of money. He has high premiums, but they're going to work this out. He can afford, maybe can't afford it, but these people are going into the specialties because they make more money. The people that are left without making much money are the family physicians. And I want to give family physicians a tax credit for their malpractice insurance. That accomplishes two things. Makes them so they don't practice defensive medicine, and that's where most of the defensive medicine comes, is with family practitioners. And number two, it will allow and cause more people to go into family practice. Number three, I think your idea about the federal plan is a good one. And in fact, a form of that is what is going to come out of the Finance Committee. Remember, we're talking about a medical exchange. What does that mean? That's what we have in the federal system. I have the same plan that somebody that works for the Bureau of Land Management has in Las Vegas, or someone that works for the IRS in Las Vegas. I have that along with 4 million other federal employees, and there are 4 million dependents who are in that program. And every year we have what we call open season, and we have 15 or 20 insurance companies that we can choose from as to what insurance we want. All the time I've been a federal employee in Congress, I've always used the Blue Cross Blue Shield. I don't know if that's the best. To be honest with you, I'm pretty lazy regarding my own business stuff. I just check that, and it's worked okay. And that's what we're going to have, a very similar thing for you. Won't be the federal plan, but it'll be one just like it, where we have an open season and people can choose what they want. All right, Jeff, thanks for your questions. Next.
The next question is going to come from Daniel Huffman in Sandy Valley, Nevada.
Daniel, go ahead.
Hello, Senator Reid. How are you doing today, sir?
I'm one of the few people in Nevada that's been to Sandy Valley.
Good to hear it. Hey, I would like to know, I've been paying very close attention to this whole debate since this started. I was on your last town hall meeting. I would like to know why we get the same regurgitation from politicians over and over and over. My girlfriend works in an emergency room in Summerlin, and one of the things she sees over and over are illegal immigrants getting better health care than people with health insurance from their employer.
Now, where did you say she works, Daniel? Where did she work?
Summerlin Hospital.
Okay, good.
In the emergency room.
Yep.
Why have we not tackled anchor babies and illegal immigrants crossing the border to get free health care in emergency rooms and basically to have free citizenship as soon as they can get to an ER to have a baby?
Sure. First of all, there was a law passed.
Yeah, I'm familiar with the law.
Well,
I'm familiar with the law.
Yeah, that's the law. And the law is that anybody in America that comes into an emergency room for emergency services, they have to take care of them. Okay. Now that doesn't mean they're going to get Cadillac care. They have to take care of them, and whatever the emergency is, send them on their way. That's the law now, and that's why your girlfriend or wife, I don't remember what it was, works at Summerlin. That's why people coming into the emergency room are taken care of. That is one of the big issues we have and I'm sorry you think we regurgitate everything. I would bet most of the people on this line didn't understand the answer on, have never heard the answer on medical malpractice. But anyway, if you've heard it before, I'm sorry I have to repeat it. As far as illegal, every piece of legislation that we're going to do with health care will not allow people who are in the country illegally to have any kind of health care. So that's clear. With that provision in emergency rooms, one of the good things that's going to come from this legislation is people will no longer have to go to emergency rooms. That's one of the big problems we have in America today. People are using the emergency rooms for their family physician. They go there, and what does that do? Everybody on this call is paying more, and if they have insurance, you're paying a lot more because those people coming into those emergency rooms with no health insurance. And they're not all deadbeats. Significant percentage of those people who have no health insurance work. Some of them work 2 jobs. It increases the cost for your own insurance if you have some. If not, it increases your taxes and certainly increases your hospital and doctor bills. So that's why we've got to get this health insurance passed to stop people from the 47 million people exactly from using these emergency rooms for their family physician. Okay, next question.
Next question is coming from Becky Fisher in North Las Vegas.
What was that first name, Ryan?
Becky.
I'm sorry.
Becky.
Becky, I got it.
Yeah, Senator Reid.
Where do you live, Becky?
I live in North Las Vegas.
Okay, great. I used to live on Princeton Street in North Las Vegas.
I live over
1620 Princeton. Anyway, go ahead.
Okay, I have a question. On this health care, is the senators and the Congress and the President, Speaker, all of them taking the same health care that you're giving us? And if not, why?
Are you saying, are we members of Congress and all federal employees having the same program that we're recommending for everybody? Is that what you're asking?
Yeah.
And that I explained to Daniel just a short time ago, I think it was Daniel, that one of the things we're doing is setting up an exchange exactly like we have. An open season. You can buy a Cadillac policy or you can buy a Model T Ford policy. That's what we're setting up, yes. Next, Ryan.
Senator, we have another question on illegal immigrants getting health care from Matthew Ballard in Las Vegas.
Good. Matthew Ballard, are you there?
I'm here.
Oh, good.
It's great to be talking to you, Senator.
Glad to talk to you.
Okay, my question in regards to illegal immigrants with health care, I mean, we've been told repeatedly that they won't be covered, but we've also been told by President Obama on numerous occasions that he's pushing for amnesty for illegal immigrants. So the way that I look at it is even if this bill says that illegals won't receive health care and amnesty is still passed, we are still paying essentially for all of them.
I think you have a very good question. Let me answer the best way I can. They're 2 separate issues, but someday they may meet. Here's where we are in immigration. First of all, we have a serious problem. We have millions of people who are here who have bad paper. They're undocumented. What are we going to do about that? I agree with President Bush, and you faint from that, but I agree with him on more than you think. I agree with President Bush on immigration. Here's what he and I said should happen. Number 1, we need to protect our borders, our northern and southern borders. Just not our southern border. Our northern border is just as dangerous for terrorists as is the southern border. So that's number 1, what we need to do. Number 2, we have to have a guest worker program that's meaningful, that works, not just for agricultural workers, but there are other businesses in America that need, on occasion, different times of the year, guest workers. For example, in Maryland, the Eastern Shore, where they get all the crabs that people, even in Nevada, eat, they don't have people that can do that work, so they need a guest worker program. Without belaboring the point, that's point number 2. Number 3, what are we going to do with the people that are here already and have bad paper? There are some people who say ship them back to where they came. Doesn't matter where it is, get rid of them, send them back. Well, there's a problem with that. This country doesn't have enough money to do that. And number two, how would you do it physically? Many of them have American wives or husbands or children. So here's what President Bush and I think should be done. Number one, these people have to pay penalties and fines, money. Go to the federal government. These people have to learn English, stay out of trouble, pay taxes, and even if they do that, they don't go to the front of the line, they go to the back of the line. It takes them about 13 years to have their status readjusted, but they wouldn't be subject to arrest. And there are a couple of other things that the President and I agreed should be done, and that is we have to make the employer sanction meaningful. It wasn't until 1986 that for the first time in the history of our country, they changed the burden from the government to the employer to enforce our immigration laws. Look what has happened as a result of that. We have all these people here who are here illegally. It hasn't worked. It's a catch-22. It doesn't work for the employer, and it doesn't work for the employee. We have something called E-Verify. It's not perfect yet, but it's getting there. And so we have to improve the employer sanction. There are a few other things, but I think you get the picture. That's what we need to do on immigration. And at this stage of the game, it's not going to change what we do on health care. Anyway, thank you, Matthew, for your question.
Next question comes from Jane Boone in Henderson.
Okay.
Hi, Senator Reid. Thank you for doing these calls. I think that they're very informative. I get very confused, as I'm sure a lot of people do, between what we hear President Obama say and what we hear from situations like this regarding the health care reform, which is muchly needed. However, my call today is regarding Medicare. I hear President Obama say there's not going to be any changes, and then I hear on the news that night that there is a bill in Congress right now to eliminate the Medicare Advantage, which I don't participate in, but I'm thinking about maybe that I should. So can you explain why we get such different stories here? It seems like they're not on the same page. President Obama and Congress is not on the same page. And also, as an added note, I'm very concerned with trying to fix health care reform when I see what's happened with the loan modifications. I mean, that's been a disaster, and so I just am concerned that they're going to go in, try to get this reform, and it too will be a disaster. Thanks for your answer.
First of all, with Jean, with the loan modification, it has. I wouldn't put it in a disaster. It hasn't. Damn sure hasn't worked as well as I'd like it. But it's been we have not had a time like this in the history of the country. Even the Great Depression didn't have the financial problems we have, and we addressed them quickly. And we have stopped a worldwide depression. Things are beginning to look a little better. That doesn't make people who are out of work, who've lost their house, have had their house foreclosed upon, losing their insurance. I understand all that, but things are getting a little better. So let's not say that healthcare is going to wind up like our economy. It's not. It's going to make things better, not worse. Let me say this. One reason that you see the president saying one thing and ours saying something else is don't blame it on us. It's the founding fathers who set up this country. It was genius the way they did it. Have an executive branch of government, independent, and a judicial branch of government, independent, and Congress. But not only is Congress a separate and equal branch of government, those founding fathers threw us a curve. They did what had never been done before. They set up not only a legislative branch of government, a bicameral legislature, one based on population and one based on the number of states. So anytime you hear the president and Congress doing different things, that's the way it's always been, and we'll never stop it because that's part of the genius of our founding fathers. However, let's talk about Medicare. And I would say to one of the previous callers, the Health Committee which bill has already been reported out of that committee, accepted an amendment to put us, that is members of Congress, into the exchange that we're creating. So it's not as if we haven't thought of it. This bill does not discontinue Medicare Advantage. It's not going to discontinue Medicare Advantage. It simply tries to bring that program into balance with the rest of Medicare. So seniors in fee-for-services and taxpayers aren't over-financing Medicare Advantage. I've heard seniors' concerns, and I'm keeping a close eye on this because in Nevada we have a lot of people on Medicare Advantage. But let's also understand what Medicare Advantage is. Medicare Advantage are programs run by insurance companies. They're programs that they come into places like Las Vegas and they do a survey and find out which of the senior citizens are sick and which seniors aren't sick. And they do what they can to entice seniors who are not sick to come into their program and leave all the sick people for Medicare. And, Medicare, interestingly enough, can't even negotiate for lower priced drugs. All those insurance companies can, which has left Medicare at a disadvantage. So, again, I repeat, no one's going to discontinue Medicare Advantage. Our job is to make sure that program is brought into balance with the rest of Medicare, so seniors and the fee-for-service and taxpayers aren't over-financing that program for insurance companies. Okay, good question, Jane.
Senator, our next question comes from Joan Slack in Las Vegas.
Okay, Joan. Joan, I'm ready for you.
Okay, thank you, Senator, for listening. Those of us that are on Social Security and have had opted into an HMO that has Medicare Advantage, would we be able to opt out and go into another program if it seemed to work better for us rather than have to take an HMO?
Joan, that's the whole point of what we're trying to do. This bill is about making health care more available and more affordable and providing choices for consumers, not only consumers who are 25 years old riding their motorcycles, but it's for senior citizens. They may have something better than what they got if they look around a little bit. No one will force you to stay or go into an HMO. And that's just fact. And that no one wants to do that. And we've got some real people. We have some centers of where there are a lot of seniors. Florida, New York, Nevada, Arizona, and we're all pulling together on this. Next question.
Thank you very much.
Our next question is from Patrick Fogarty in Reno.
I was really worried we haven't had a call from Reno today. I'm glad we have one. Patrick, please go ahead.
Hi, Senator. This is Kathleen Fogarty. I think they got my name wrong.
Okay, well, you sure don't sound like a Patrick to me.
No.
Thanks, Kathleen. Go ahead.
I want to tell you that I've been a supporter of yours since you ran for lieutenant governor in the state of Nevada.
That's when we were both kids, right?
A long time ago. I have some concerns about the health care reform plan. If the public option doesn't get passed, it looks to me like it's going to be a big windfall for the insurance companies, and that concerns me.
Well, Kathleen, it should. Let's talk about that a little bit. I mentioned early on this call that we're having the sweetheart deal that insurance companies have had since Pat McCarran, one of my predecessors, teamed up with a guy from Alabama to pass what is called McCarran-Ferguson. And what they did is exempt insurance companies from the antitrust laws of this country. It was supposed to be in effect for 2 years. That was 70 years ago, and it's still in effect. And I repeat, the insurance industry is the only business in America not subject to the antitrust laws except for Major League Baseball. And so the question you raise is a valid question, and that's why I so support the public option. We had a little bit of good news earlier this week, though. The lone Republican who's still talking like she might support health care reform is Snow from Maine. And here's what she came up with, which is a pretty doggone good idea. She said, okay, here's what I'm willing to consider. We will set standards and goals that insurance companies must meet, and if they don't do it by a time certain, then we have a public option. I think that is better than the so-called co-op they're talking about. My first choice is a public option because I think it'll create competition and make the insurance companies more honest. And my number two choice is the trigger, that is that Snow talked about. Number three is the co-op. We have 40 some odd co-ops around the country, a big one in the state of Washington, and it would be better than nothing. But it's nothing that I'm going to jump for joy with because I think we have to be very careful that at the end of the day we don't wind up giving a bouquet of roses to the pharmaceutical industry or to the insurance industry, and they're the ones, they're going to get a lot of new customers. They're the ones that are making all the money during this time of stress for most people. Thank you very much, Kathleen. Okay, Ryan.
Senator, our next question comes from Howard Rast in Amagosa Valley.
Say that again.
Howard Rast?
Yes. Hello,
Howard.
Senator. Yeah, thanks for the opportunity to talk to you. I'm concerned about the coverage for everyone in this country, and if that is implemented, there are not enough doctors, hospitals, clinics, nurses, laboratories, and medical infrastructure to handle them without there being tremendous waits, delays, and denial of coverage. And that bothers me.
Well, Howard, let me just comment on this. We have a problem right now because right now people are getting sick and they're getting hurt, whether they have insurance or don't have insurance. And they're going to somebody to get help. Not all the time. If you don't have insurance, it makes it very rough. But if you do have insurance, you go someplace. And those people that don't have insurance are clogging up our emergency rooms and other indigent programs. So a couple of things that I think we should be aware of. We need to stimulate the desire of physicians to be family practitioners. Again, I repeat, that's where so much of the defensive medicine goes, is that people visit family physicians. But these general practitioners aren't willing to be general practitioners anymore because the big bucks are out there being neurosurgeons and surgeons and radiologists and cardiologists, and the people that the so-called traffic cops, that is the family physicians, there aren't enough of them. We're losing them all the time. So we have to do something to stimulate that. What does that mean? We have to have increased graduate medical education slots for Nevada. We need them for Nevada. We need them for Florida, some of these rapidly growing states. We need to have a couple things for primary care doctors. We have to have loan forgiveness for their loans that they, and I don't mean, wouldn't necessarily have to be total, but they would have to get some financial break from their exorbitant costs for going to medical school, unless your family's very, very rich, and I mean very, very rich. These doctors can come out of medical school owing. I have my cousin's son, Las Vegas, and he is a radiologist. I talked to him the other day. He's at University Medical Center in Las Vegas. I said, "How much are your loans?" He's just been a doctor a year and a half. $300,000. So we for primary care, we've got to give loan forgiveness, because I'll bet a lot of these doctors, if they had loan forgiveness, they would do the family practice. We need to make practicing medicine, particularly in Nevada, attractive to students. So those are some of the things we can do. Repeat, this bill is about making health care more affordable and providing choices, and in the process, hopefully make the number of physicians increased, especially in primary care. But your question, Howard, was very, very good.
The next question comes from Laura Curry in Fallon.
Hi, Laura.
I had a question about broadening the ability for Nevadans to choose between more insurance companies than 2 or 3 that are currently here. I think part of the problem for people who can pay for their own insurance right now in Nevada don't have choice and would be able to better afford it if Washington would change those rules now, it would be an instant relief for all of us now if that could be done.
Well, there's a number of people talk about interstate insurance, okay? That why should somebody in Nevada, why shouldn't they be able to go to Alabama and buy their insurance? Well, the problem with that is that with the situation we have, as I've already explained with the McCarran-Ferguson, which these companies aren't subject to the antitrust laws, you could go to Alabama, and I don't pick Alabama, I could have picked any of the other 49 states, and find some cut rate insurance. They could come in and collect the premiums and disappear. You'd have no recourse. So we have to be very careful. Our state insurance commissioner makes insurance companies sure they try to make sure insurance companies in Nevada are on the level. The problem we have, and is because these powerful big insurance companies, there's about 20 of them, rule the world. And if the Nevada Insurance Commissioner questions them a lot, they have more resources by far than the whole state of Nevada. We do have solvency requirements. We have some consumer protections, which are good, and we have some watchdogs for Nevada in our state, and that's good. We need to make sure insurance companies are accountable in Nevada. I don't like the forum shopping, going up Wisconsin. I heard they had a good plan up there. Let me do that, and then something goes wrong, and you're stuck with dealing with the insurance folks in Wisconsin. If we got rid of the antitrust law that we're going to try to do, we wouldn't have to deal with that. And even if we don't outright repeal McCarran-Ferguson and we do our job on this healthcare reform that we're working on, we will be in a better shape. We'll get rid of some of that stuff, if not directly, indirectly, some of their ability to be bullies. Okay, Ryan, I'm ready for another one.
Senator, our last question is going to come.
Well, let's see. A couple more questions. I have to be out of here in about 6 or 7 more minutes. So.
Next question comes from Alice Dewberry in Boulder City.
Alice, okay. Boulder City. Right,
Alice Dewberry, Boulder City, Nevada.
Do you ever make it up to Searchlight?
Yes, I have been to Searchlight.
Well,
and I know some dear friends of yours, too.
You ever see
my question is...
Hang on, let's just talk. I got to get a little homesick here. If you ever come by Searchlight and you see my shutters up, that means I'm home.
Okay. All right.
Up on by. Okay, go ahead, Alice.
Is there a way to make it possible for Medicare to negotiate drug prices?
Oh, I talked about this a little earlier. Okay, here's one of the things that I indicated that I think is so wrong. Medicare cannot negotiate for lower priced drugs. They have to go to Rite Aid or CVS and buy their drugs like everybody else. All these insurance companies, they can negotiate for lower priced drugs, and so can the Veterans Administration, all these HMOs, but not Medicare. And so I have no doubt that before we're through on the floor, there will be an amendment offered to change that. I would also say for everybody here, one of the things, I forget one of the earlier calls, talked about the president saying one thing and we say something else. One of the things I think you're going to find interesting is that there's some people in the administration have made certain arrangements with the drug companies, but we're not bound. We in Congress aren't bound by those. Okay, last question.
Senator, our last question comes from Jolene Will.
Jolene?
In Mound House, Nevada.
Oh, boy, that's good. A little rural medicine.
Hi, my name is Jolene, and I'm 29 years old. I have serious health issues. I have only one kidney with a disease. I have high blood pressure, and I'm diabetic. And I can't afford health insurance on my own. And I just want to know if this health reform is going to help cover pre-existing health problems, because if you go to Blue Cross Blue Shield, they'll deny me right then and there, or it will cost me an arm and a leg, which I don't have.
Jolene, let me respond to this, okay? But let me just, in passing, I only know one other Jolene in my life. Her name was Jolene Burnson. She was in high school. She was the prettiest girl in high school. She was so pretty. Anyway, so Jolene, here's the deal. We will not let a bill get out of the Senate unless there is something that makes the insurance companies unable to deny anyone for a pre-existing ailment. Right now, I don't know if you have any insurance, but if you don't, you'll never get any because they will deny you in a split second. But just because you were born with bad genes and have a bad kidney, high blood pressure, you're diabetic, that doesn't mean you shouldn't be taken care of and have health care. And so I repeat, and what I said earlier in my opening statement to you, we are not going to allow insurance companies to prevent people from getting insurance because they have pre-existing disability. We have people that are not nearly as ill as you are. I had a letter that I talked about the other day. My staff gave me a series of some examples of letters from Nevada. A woman had what is it called? Acid reflux, as my dad would say, a heartburn. And they listed it. She couldn't get insurance on a different policy because she had heartburn. These insurance companies have been pretty brutal to people. Thank you all very, very much. I'm grateful to you for spending this hour with me. I hope it's been beneficial. I'm going to, and Kate, not everybody got to ask a question. John, I'm going to do another one of these when? Next Thursday, a week from today, I'm doing another one. So I hope everyone will, if they didn't get to ask a question, you can sign up for these earlier, and I'll be very happy. I'm grateful to you for listening to me, and we're going to get health care reform one way or the other. Thank you all very, very much.